promoting community mental health guided by the values, strengths, and informed choices of the people. Quality services which promotes recovery, community participation, self-sufficiency, and item 3. I'll take a motion. Aye.
Aye.
Any opposed? Motion carries. Hearing of the public. Is there anyone from the public wishing to address? Amendments within the HHS. This has been approved legal. I'll take a motion. So moved. Support. So, Helen?
Yep, thank you. All right, so you got your information in your packet. This is the specialty grants that substance use receives from the state. So a couple of the grants needed adjustment. One is our healing and recovery funds. That's from the opioid settlement dollars that came in through the state. So the 2025 funds that were unused got rolled over into 2026. So we had an additional almost $89,000 we have access to for this year. So that's really good. Those dollars are helping to support the engagement center, so, along with some other things, but that's one of the main uses of that money. A lot of the, there was a lot of small updates that were related to typos, word changes, things like that. They have what they call special provisions, which are kind of like contract-like language that they put into these grants that they updated. They redefined certain words and terms in there, changed due dates on some things, or updated forms. So a lot of just little work that was being adjusted there. They had a change that they did in some of our other contracts before, but they can't use certain terms anymore because of laws that were passed. So they have to make sure that there's nothing that says harm reduction in their contracts anymore. So we have to say we're targeting people at highest risk for overdose or things like that, which is still the intended use of the funds, but a lot of that was language cleanup.
Thanks, Helen. Questions? All in favor?
Aye.
Any opposed? Item 5. Megan, support by Sharita.
All of those in collaboration. Does have a statement about associated projects. But because it has that word, I think small, just so there's no. I guess I'm also acknowledging that to answer a question that was posed, but also to express.
Questions?
Aye.
Any opposed? Contract renewal? Is that you, Donna? Okay, Donna and Lord. Donna and Lord, thank you. Just give us the lowdown.
Oh, yeah. So, I guess as a point of clarification, it's an order that's already been renewed. It's is the product that compliance uses for managing policies and procedures, and also the product that finance developed their contract management functionality in. So. Just a continuation, when it was brought to the board originally several years ago, it was brought as a auto renewal in the contract that we signed with them. And so this is an amendment to include the integration for the signatures that was added by finance.
Favor?
Aye.
Aye.
Any opposed? Carries.
I'll move with the amount amendment. Sorry.
Good catch. Support.
Okay, both.
Both of us, thank you.
Yep, and similarly to the last one, this is also an order. This is a renewal of our Microsoft 365 licensing, along with things like email encryption, security awareness training. Any questions that anybody has about it, I'd be happy to answer. It was brought to my attention that there was a section on the order form that was left blank that had sales tax exemption. We do have a sales tax exemption from them, and we filed that paperwork with them. Yeah. Mm-hmm.
Any questions? Okay, everyone.
Aye.
Thank you, Thomas.
Thank you.
All right. And support by Sharita. Okay, it says you.
Yeah.
Thank you.
So if you notice, it's like a work order change, all it's doing is keeping. This, the current contract agreement. This month, that's where.
Aye.
Any opposed? Seven is resolution. And file. So moved. Support. Motion by Lori, support by Donna. And Tracy, did you want to speak to this?
Sure, just to honor Paulette. If you're not familiar with Paulette, as it mentioned, she's been with us for 19 years at Crossroads Clubhouse. She is an amazing force. One of the statements in there describes her as calm in the storm, which I greatly agree with. She is definitely that. So it's a great loss for us, but of course we wish her and congratulations in that. She does have a open house this Friday the 13th. That sounds bad, but it's it's not. I think it's from 1 to 4 at Crossroads Clubhouse if you're interested in wishing her all the best in her new adventure.
Does anybody else have anything they'd like to add?
Yeah.
Donna, I thought you might. Go ahead.
She served on the advisory board with me for the whole time I've been there. It's a great loss, but, I'm really happy because I know she has her family, but she will be greatly missed. She's been our secretary on the advisory board, actively trying to, but been kind of a backbone at Crossroads. Jack of all trades, go to Paulette, so, we're gonna have to be, to do that, but, she's been a great friend, a great advisor, and someone that's really been the best for her. Thank you.
Else have anything they'd like to add? Motion and support to receive and file. All in favor?
Aye.
Any opposed? Motion carried. Other possible agenda. Item 8, other possible agenda items. Reminder that we'll have a full board meeting here Wednesday, March 26, 2026 at 6 p.m. Item 9, provider comments. Any providers wishing to address the board? And hearing of the public. Anyone from the public wishing to address this board? Item 11 is closed session. Okay, item 11 is closed session to discuss attorney-client privilege memo dated March 11, 2026, pursuant to MCL 15.2681H.
So moved. Support.
Motion by Lori, support by Megan, and then I do a roll call vote, right? Okay, roll call vote to go into closed session. Jackie?
Yes.
Donna?
Yes.
Lori?
Yes.
Megan?
Yes.
Phil?
Yes.
Me? Yes. Sharita?
Yes.
Wayne?
Yes.
Okay, we're going into closed session.
Okay.